color context.
So
Uh,
what are we doing today, Dr. Isaacson?
well, Max, I'm so excited to be here. We are, I guess it's live Q&A, Ask the Brain Doctor. I guess I'm the brain doctor today, and you get to ask me questions, and we get to talk about brain healthy nutrition. What a cool topic.
Very excited. It's a topic that both of us know a thing or two about.
Indeed. Indeed. Your
Um,
book sold more copies than my book, but I've written a few of these books, and you've written them too, and we've worked on, public scientific publications together. But yeah, I'd love to learn from each other. We get to talk about brain health. You are what you eat when it comes to brain health, and I'm ready to start answering some questions. We already have questions strolling in. We had hundreds of questions beforehand, and um what I would say is the topic of this is supposed to be focused mostly or mainly on nutrition, but I am happy to answer a few off-topic questions if that's cool, maybe towards the end. And I see a couple of questions in the chat that aren't exactly about nutrition, but I'm happy to kind of do whatever and want to help what the audience wants to learn about.
Amazing. Well, we have the list. Should we just go through them, Dr. Isaacson? We have
Cool.
we've collated our top 15 nutrition related questions, and then yeah, as you alluded to, we can kind of broaden out the lens a little bit later on. But should we just start with number
Let's do
one?
it. Let's roll. Let's roll in. Let's do it.
All right. Um, okay, so this is a good one actually. Starting, diving straight into the deep end. What do you think of your 2021 article on precision nutrition for ApoE4 carriers? Has anything changed from 2021 when you published that paper to now, 2025?
Oh, what a question. So I just had a flashback to my office at Cornell, meaning a broom closet in the clinic where we had to where I finished that paper with some colleagues. And I think what I would say is so much has changed in the last 4 years. And when you write a paper in 2021 that gets published, it's actually based on data from like 2018 to 2020 because it takes a long time for papers to get published and written and that kind of thing. So what I would say is gosh, so much has changed. So the concept of precision nutrition, where a person has a specific gene or set of genes and then gets a roadmap about what they should eat based on those genes, that's evolved quite a bit. So that's one thing. We've learned a lot more with the granularity about people with one or more copies of the ApoE4 variant of the ApoE gene. The other element here is we don't just in 2025 look at a gene and give someone a diet to eat. That's what we used to do. But now we basically cross compare. So we look at the genetics, we look at the biological factors. So what are the cholesterol levels? What are the metabolic numbers, the insulin and blood sugar, and what are the amounts of omega-3 fatty acids in the blood versus saturated fats and trans fats? So we use real-time data plus genetics to inform. And then now we have an entirely different level where we look at in real time blood markers of amyloid and tau and different sorts of inflammatory proteins. And we have learned so much, and then we refine or fine tune the nutrition patterns based on the individual person. So, to answer your question, that paper was really helpful 4 or 5 years ago in terms of giving someone a generalized roadmap. I think big picture, let's talk about the Mediterranean style diet. There was a paper that came out recently, and 1% of the population has two copies of the ApoE4 variant. Okay. A lot of people think they're doomed. No, genes are not your destiny. You can win the tug of war against your genes. And the Mediterranean style diet, when followed in people with two copies of the ApoE4 variant, lowered risk of dementia by 35% just by changing your diet. And then if you really followed it, increased the compliance even more, it lowered even more than 35%. So when you add in the diet and the exercise and all these other things, what I would say is the evidence today compared to that paper in 2021 is so much stronger that you can make a tangible impact on the ApoEs. If you have one or more copies of ApoE4, and just to set the stage, mom and dad give you an ApoE2, a 3, or a 4. So everybody out there has the ApoE gene, and you could be a 2-3, a 3-3, a 3-4, a 4-4. 1% of the population is 4-4. Um, Omega-3 fatty acids, wild salmon, lake trout, mackerel, sardines, albacore tuna, maybe once a week to balance out the heavy metals. Omega-3 fatty acids, Mediterranean style diet, Vitamin D, making sure the levels are probably at least 50 or so. That's kind of, talk to your doctor, but that's kind of what we shoot for in people with 4-4 or 3-4. Those are some of the core tenets. Smoking, real bad for ApoE4-4s or 3-4s. Alcohol, much worse for someone with 2-4s or 3-4s. So, I think the evidence has just gotten more robust, and the 2021 paper is good as an initial roadmap, but now we just have so many more levers to pull and dials, and things are just so much more precise.
It's very exciting, super exciting stuff. Um, okay, well, thank you for that thorough and nuanced answer.
Sure.
Moving on, this is a question that I in particular really like. In the context of ultra processed foods, are vegan protein powders and bars harmful? Maybe you can start by defining what ultra processed foods are. Maybe that's a new term for some listeners.
Yeah. Wow. You got the questions today. And I'm going to lean on you a little bit, actually a lot of it for an answer. So ultra processed foods are basically anything that like wasn't natural. So when you go to the supermarket, to me, I try to stay around the edges. So you have the cold section, anything in a bag that like has an expiration date of like 2 years. That's generally processed or ultra processed. There are, you know, varying ways to think about these foods, but the vast majority of evidence, especially over the last few years, and this evidence didn't exist when I first met you, Max, a decade ago, ultra processed foods basically make it the shelf life stronger and the storage easier. And then you also in plastic bags or whatever else, which may also cause all sorts of things. Ultra processed foods just are really bad for you, bad for cardiovascular disease. They're bad for cognitive outcomes. And fresh foods, non-processed foods, fruits and vegetables, for example, are a great one. Those would be different. Is that kind of how you teach people about it, or any other nuance you have there?
Yeah, I would say that I mean, we are trying to arrive at a more crystallized definition of what an ultra processed food
Yeah,
is, because even within the bucket of ultra processed foods, there's a signal that some are worse or better
yeah,
than others.
yeah,
I would typically describe it as a food that you couldn't possibly make in your own kitchen if you tried. I would say the number of ingredients is a good proxy, although it's not a
yeah,
fail-safe, but a food product with a lot of ingredients that you can't pronounce.
yeah,
We shouldn't be afraid of chemicals that we can't pronounce. But on the other hand, sort of like the BMI, it's not necessarily the best diagnostic tool, but it is a fairly reliable screening tool for what might be an ultra-processed food.
yeah,
And what's actually kind of interesting is that when I wrote my first book, Genius Foods, we dedicated many pages to warning of the potential harms of overconsuming ultra-processed foods. But at the point at which we wrote that book, the data linking those foods, the overconsumption of those foods to brain health outcomes hadn't existed.
yeah,
So it was very prescient on our part, I
yeah.
guess. Just pat myself on the back for that one a little bit. But going back to the question,
Yeah.
the
Well,
the yeah,
oh,
sorry.
sorry. And with ultra processed foods, like there's a lot of nuance here, and some are better than others, and it's also like quantity, not just in addition to quality. And we talk, and anyone out there that wants to learn about nutrition and wants to help get a personalized plan, we have free software out there that you can go to, retainyourbrain.com. It's free software. You sign up, they get to know you. You talk about what foods you eat, what you exercise, what your risk factors are, your ApoE4 gene. You go in, and then the software learns about you. You can do cognitive challenges. You can track different things. If you go to retainyourbrain.com, if this information is, if you're on overload but you want to learn more, also if you're a doctor that's watching, or a physician assistant or a nurse practitioner, if you're out there and you treat patients, any healthcare providers, send this to your patients. They can help. They can learn about brain health. And there's so much nuance here, and I'm glad you said that. But like one of the things we talk about in Retain Your Brain, like read nutrition labels and how do you read it, and like the ingredients. The fewer, the better. And I couldn't agree with you more. So yeah, I just wanted to point that out. Back to the question. The question was about ultra processed foods, and see, my brain is not fully functioning.
And vegan protein powders and bars. Are
Uh,
vegan protein powders and bars harmful?
Oh gosh. I think there's a lot of ways to fry an egg here, but I'm a whey protein kind of guy. That's just me. I don't know. That's just me. That's what I do for myself. So that's what I know. I've used like pea protein powders. I haven't really gone too deep in terms of the purity, and I think I don't know if we fully have all the answers about the differential effects of the various, whey, which is like, milk protein, which is non-vegan, versus pea protein, for example. So I think I would say the jury is out a little bit. And I'm like a whole food kind of guy. I like whole foods. I do use some protein powders. It's really hard for me to get the amount of protein that I need based on, my weight and what my doctor tells me and what I think myself. So I do use protein powders. Probably, I get about 15 to 20 grams of protein in powders a day. And then I try to get, at least 60 grams otherwise a day, which is maybe on the low side, but it's just really hard for me. I don't know. What's your philosophy on protein powders, Max?
Yeah, I like to I use whey protein. It's less processed. Whey it's a byproduct of cheese making. So it's actually a minimally processed food. I would consider it more of a food extract. Whereas vegan protein powders and protein bars in particular are much more processed. And there is a concern with vegan protein powders that there's the potential for heavy metal contamination. Now, if you're just consuming a vegan protein powder, once in a blue moon, I would say it's probably no big deal. But I mean, protein powders are usually the kind of thing that somebody is consuming on a daily basis. And so for that, I would just recommend a cleaner product. And, those tend to be whey proteins and vanilla or unflavored whey proteins in particular, because even chocolate flavored whey proteins have been shown to harbor lead because cacao can suck up lead from, depending on the soil that it's grown in. So yeah, vanilla or whey or unflavored whey protein for me is always going to be the default.
Same. Yep, I'm right there with you, and that's the exact. We won't talk about brands for right now, but yeah, that's exactly my philosophy too.
All right, moving on. How do you find high quality extra virgin olive oil and how to use more of it?
Well, this is really important. So I remember, I think we talked about this on a TV program once. 60% of olive oil out there on the shelves is adulterated, meaning like not real or not pure or not or rancid or not good. The devil is in the details. Extra virgin olive oil is like one of the most powerful things a person can do to optimize brain health. There are brain healthy fats. So we talked about fish and fatty acids from fish, omega-3 fatty acids. They're very, very powerful. That's called a polyunsaturated fat. Olive oil is monounsaturated fat. There's PUFAs and MUFAs. Sorry for the technical terms, but you got to get quality olive oil, extra virgin olive oil. And how to do that? Well, number one, read the reviews online. Number two, what is the expiration date? When was it harvested? Is it in a bright light? Is it in warm temperature? There are things like that. I only order my olive oil from two different places. They're both in California. I've been to their little shops, at the side of the road sort of thing. So I try to get extra virgin olive oil from quality sources. And I also have a friend that lives in Italy, and he sent me this big thing of olive oil, and we use that, and when you cook with it, you can maybe use one olive oil for cooking because you go through a lot of that, and maybe you may not want to use the really, really expensive pure stuff. Obviously the stuff gets expensive, but if you're going to be eating olive oil on a salad or drinking it, like I recommend to some of my patients, like literally a shot of olive oil. I don't know what you think of that, but I it's kind of yucky in the mouth, but you can taste the taste, the oligocanthols or whatever it is. So yeah, do the reviews online. Try to find extra virgin olive oil that's quality. Max, what are some suggestions that you have?
Yeah, I mean, I don't have any. People always ask me, it's one of the most common questions I get, what brand do you recommend? And I think part of the joy of cooking and enjoying food is to sample the wide array of extra virgin olive oils that are available to you from different parts of the world, Italy, Spain, Australia. I've had some really good extra virgin olive oils.
Yeah.
So yeah, no real guidance there other than just, I would suggest buying your extra virgin olive oil in small bottles
Mm,
because it's a fresh fruit juice essentially that only gets worse over time after it's been exposed to oxygen. It's not like wine that gets
yeah,
better over time.
yeah.
You want it to be as fresh as possible. So my advice would be to buy in small bottles. Make sure that it says extra virgin olive oil. Look on the back, make sure it's not a blend,
Mm.
and just go through it. Use it as fast as possible, and then buy new.
Yep. And the other part is if you can, once you start, it's like I don't drink wine. I don't drink, and actually, I get headaches from wine, so I don't drink wine. Alcohol, olive oil, I've gotten like my taste buds kind of akin to, and I can tell now if you try olive oil and it does something to the roof of your mouth and it feels a little funny, burns a little bit, that's probably real and that's probably good. And if it doesn't and it looks like clear, then it's may not be as real. And there's ways to, get these levels checked, and you can talk to your doctor. There's also at-home tests that you can do. If you go to retainyourbrain.com, there's ways to learn about how to get your levels checked and how to do all these different things. And basically, yeah, you are what you eat, and sometimes you got to check your blood to make sure you're eating enough.
Yeah, love that. All right, moving on. Is 2% milk, this is a very specific question. Is
Okay.
2% milk from grass-fed cows safe for ApoE44 carriers? So the dairy fat, I'm assuming, from dairy milk, is that safe for ApoE44s?
Yeah. So so that's what I drink. That's the I drink. I know this sounds crazy. I either drink whole milk or 2% milk from grass-fed animals. Now, you would say, why would you only do if you're going to have grass-fed milk? Why don't you just do whole fat or full fat? Because if the cows are eating grass and the grass has omega 3s, brain healthy omega 3s in it, then you want as much fat in the milk as possible. So I don't know who's asking this, or maybe you've heard this from me because I may have been talking about this in the past, but um, in order to split the difference, because I think I know what the right answer is, but I'm not entirely sure. A lot of times with people that have two copies of ApoE44, if their cholesterol or their saturated fat levels when we check are borderline or just like maybe something you just want to be cautious about, I kind of split the difference and I do 2% grass-fed milk. So that may have been something that I've talked about. I think now I've veered more towards whole fat milk with that's grass fed. And I think it's hard to just make a dietary instruction just based on a genetic finding. And that's, Max, is what we talked about earlier. In 2021, that's what I did. But now we can track so many more things in the blood and the fidelity. We have this research program that we've been working on at ind.org. We're working on blood tests, trying to democratize access to blood tests at ALZ Labs, alzlabs.org. And we're trying to really figure this out and develop the right testing and do the research to sort this out. But yeah, I think if you want to split the difference, that's reasonable. And just talk to your doctor and check your cholesterol and check your blood metrics. And I think that's a reasonable option. Max, I would guess that you drink full fat grass fed milk when you drink milk. Is that correct to say?
Well, it depends. I usually will do full fat dairy, but I also will sometimes do reduced fat or low fat dairy if I'm trying to lose body fat because that gives you some leeway to ingest those fat calories elsewhere. So
Yes.
I'm
Yes.
of the opinion that dairy fat is healthy. Butter is a little bit of a gray area, so that's the one asterisk is that butter might be uh, less so depending on who you ask, but butter has a differential effect on lipids due to the loss of milk fat globule membrane, which is a bit technical, but
Mhm.
in general, I think dairy fat is very healthy, and it's actually been shown in the literature that dairy fat has this paradoxical neutral effect on lipids, even though it's predominantly saturated fat. But if I'm trying to lose body fat, it's a great way to economize. You're consuming less calories when you consume a reduced fat or fat-free dairy product.
Yeah, and the take home point with a lot of this is, I don't count calories. Like to me, calories isn't the way that I do things, but I know that fat is a lot more calorically dense. And there's protein and there's carbs and they have different, caloric whatever. So I agree. What are you trying to solve for? If I'm trying to maintain my weight or build muscle, I will have more protein and, I need a sufficient amount of carbs and protein to build muscle. But if I'm going to be overloading or increasing my carbs, then I may want to reduce my fat a little bit. Also, it depends on like how you feel. Like high fat stuff, like sometimes gives me a stomach ache. So, everyone's just a little bit different. But yeah, know your body and target things based on you.
Okay, this is question 5. This is related, so maybe we can just kind of do a rapid fire response to
Sure.
this. But should ApoE44 carriers avoid all dairy?
I don't personally think so. I think, let's talk about ApoE44s and pesticides because I think not all dairy is created equal. Just like I'd rather someone with an ApoE4 variant, one or more copies, have sufficient amount of omega-3 fatty acids, again, from fatty fish. Some people can take supplements. A lot of people My patients, they eat fish twice a week. They still omega-3s are low. People with one or more copies of the ApoE4 variant need omega-3s, and a good way to get omega-3s aside from fish and supplements could be from grass-fed milk. So, as my mom would say, everything in moderation. I'm okay with E44s drinking milk. I think the question here is like, well, what else about the milk? If it's not grass-fed, which is, by the way, more expensive, harder to find, less fresh, and you got to balance that out. But when it comes to is it organic? Are there pesticides? And in the United States or Canada, there's we don't have to worry about this DDT or DDE. It's a metabolite. People with one or more copies of the ApoE4 variant that are exposed to pesticides in foods increases your risk of dementia and Alzheimer's by sixfold, 6 times, which is crazy. Now, in US and Canada, again, legacy contamination, these were banned in the late 70s, so there shouldn't be any there. But whether you're having produce from outside of the country, if you're traveling, if you don't live in the United States and you are living in a country that may have pesticides, then you may want to choose organic milk, and you want to know where the milk and the farms are coming from. So I think the devil is in the details. I think some of it is a fat question, some of it is a quality of fat question, some of it is a pesticides question, and when in doubt, everything in moderation.
I like that. Uh, okay, question 6. Should I have my choline levels checked?
Haha. I
I
don't
didn't even know that
recall.
you could check choline levels.
I
That's
think
not,
you
I don't think that's a thing.
I think you can. We're both stumped, Max. Let's remember the day, September 10th, 2025. We both don't know something about brain health and nutrition. No, so that's a great question. I personally, I'm pretty sure you can check it.
Hmm.
I haven't personally done it. I think the challenge with choline is, and I'm pro choline. I think choline is protective and helpful on the brain. I think more studies, especially from the last 10 years, have come out. Eggs, I think a lot of times, like cardiologists and medical doctors like me have vilified eggs. Oh, too much eggs or the yolk, it's cholesterol. Like, I don't know that eggs really raise cholesterol. And that's, a whole complicated thing. And I think, the dogma that I learned in medical school wasn't exactly right. So I'm okay with eggs. I actually advocate for eggs. I'm not sure if 4 to 6 eggs, 6 to 8 eggs a week. I don't know what the sweet spot is, and it may depend on the person. But choline in eggs and choline from other sources, I believe are brain healthy. I have never, now as opposed to like, I check vitamin D in my patients, B12. We check, omega-3 fatty acids. We can check olive oil levels, monounsaturated fat, trans fats. We check those, and then we target the diet based on that. And if you want to learn more about how we do this, you could go to Retain Your Brain. Retain Your Brain is free software that talks all about this, and will give you eventually resources on how to check some of these things and give you like kind of a help with the roadmap forward to do this. But in terms of those are the standards of things that we check nutritionally that we then iterate on. But I've never actually checked a choline.
Yeah, I mean, I know that dietary levels can be assessed via food frequency questionnaire and
Yeah.
and whatnot. And there have been studies linking dietary choline intake to various health outcomes. But
Yeah. What
yeah,
is your recommendation nowadays for eggs?
I mean, I don't really, I think, there's obviously the individual impact that dietary cholesterol is going to have is going to vary to some degree person to person. A minority of people are hyperabsorbers of dietary cholesterol, but as a general blanket rule, I don't really place any limit on eggs. I think 2 to 3 a day is likely fine. Um,
Okay.
and I do think that choline is very important. I think choline is very important for pregnant women. Choline is very important for uh, obviously brain health. It's the backbone to acetylcholine. And lo and behold, 90% of adults do not meet the adequate intake for choline on a daily basis.
Yeah.
So yeah, I am 100% for it. There's of course the possibility that you might be a hyper responder of dietary cholesterol, but that's something that you can test
Yep.
for.
Yep. Love it.
What are the specifics, moving on, the specifics of the Mediterranean diet? What's most important?
Well, okay. What's most important? I think the individual. So let's talk first of all. Let's zoom out. Dietary patterns, Mediterranean style diet, mind diet, ketogenic diet. That's a pattern of how a person can eat. And then there's or the ELF diet. You ever heard of the ELF diet? Why has no one heard of the ELF diet?
I've never heard of it. What's the elf diet?
Oh my! I stumped him. I stumped the brain health nutrition expert.
The elf diet?
ELF diet.
What else eat? I'm thinking like Santa Claus, like holiday foods, gingerbread
Oh,
cookies.
eat less food, caloric
Eat
restriction.
less food.
Yeah, people eat way too much. I mean, that's the thing, right? So you can think in terms of like dietary patterns, and then you can think of single or multiple nutrients, right? B12, omega 3s, vitamin D, stuff like that. Turmeric, cocoa powder, there's all those sorts of things. So to me, what are the components of a Mediterranean style diet? I think it depends on the individual person and depends on, let's start by like the vegetables. Green leafy vegetables, when they actually looked at the components of the Mediterranean style diet that have the most brain protective effects, I believe the data has shown that the green leafy vegetable component, dark green leafies, have the best bang for the buck in terms of what is the individual component of a Mediterranean style diet on the whole. However, if you have one or more copies of the ApoE4 variant, fatty fish, eaten on a regular basis a couple of times a week, those omega-3 fatty acids I think are super important. Um, I think lean proteins may be more relevant for certain people. Red meat in moderation. I think red meat is complicated because some people think red meat's bad, some people think it says cancer, some people says it's good, it's the best, you can eat as much as you want. I'm halfway down the middle, like let's everything in moderation. And Max and I may think about this a little bit more nuanced, but if it's grass-fed beef and it's sustainably farmed and like whatever else, like I think the different and like meats that are like processed and like with lots of nitrogen and like that kind of thing, like I don't know what to do about that. But what I would say is like you go through the Mediterranean style diet and alcohol in moderation may be okay for the general dietary pattern, but if you have two copies of the ApoE4 variant, I think no alcohol is better, or maybe one or two drinks a week, and same thing with one copy of E34. So that's the way I think about the Mediterranean style diet. Uh, Antioxidants, berries, blueberries and strawberries. Nurses Health Study showed a delay of 2 years of cognitive decline. So I think, fruits and vegetables in the Mediterranean style diet are key, and the berries would be the most, I would say, impactful. But how do you conceptualize this next?
Yeah, that's a great question. I think about it less in terms of its individual dietary components and more in terms of the overall diet, the overall quality of the diet. So the Mediterranean diet traditionally is a minimally processed diet, particularly when contrasted against the standard American diet, which is now around 60% ultra processed foods. I really think about the Mediterranean diet as a heuristic, as just a higher quality, less processed diet. It's a diet that, will use extra virgin olive oil instead of, for example, ultra processed grain and seed oils, which have only been on the market for the past 50 or so years. But historically, in the Mediterranean region of the world, they use predominantly extra virgin olive oil, maybe some butter here and there on occasion. But they use, I mean, if anybody's ever spent time in a Mediterranean kitchen, they're using extra virgin olive oil like it's getting everywhere. They
Yeah.
use it to cook, they use it to dress your foods with. Um, yeah, fewer refined grain products. That's pretty much it to me. Dark leafy greens, nutrient dense foods. I mean, that's like, and it's becoming even in the Mediterranean a rarity actually, as we've begun to export,
Yeah.
the standard American diet. So that's pretty much my view on it.
Love it. So maybe we'll do like one or two more pre-submitted questions. We have so many questions in the live chat. We are going to start pivoting to those soon. So thank you for everyone for asking. They are like zooming by, so we're going to do as best we can to get as many of them as possible. And yes, we can go off topic a little bit, maybe towards the end, because there's a couple of really relevant ones. See one on HRT, one on cholesterol. There's really good questions in the chat. But maybe we'll do one or two more pre-submitted questions and then pivot. What do you think, Max?
Yeah, sounds great.
Cool. And then if
Um,
if you're if you're watching, there's a lot of people here. If you could just remember in the chat, remember to fill out this Q&A survey so we can improve these sessions. We really want to provide lots of education, free information, doing these live Q&As. I've been doing these a couple of times a month, kind of like a pilot to see how it goes. We'd love your feedback. How can we do this better? Should these be focused like nutrition-based topics? Should this be a free-for-all? We're trying different permutations. And also, if you haven't out there yet tried our free brain health tool. This was a study. We did a randomized controlled clinical trial, retainyourbrain.com, NIH funded study, 988 people. We presented this at the American Academy of Neurology meeting. The people that use this software reduced their risk of Alzheimer's disease by 6% in only 6 months. And this is software that's available for free. So if you go to retainyourbrain.com, check the chat. to learn about all these things. But let's keep going.
All right, so yeah, well, I've just literally noticed where the window is where you can take the questions that are now being submitted via Zoom. So
Okay.
I'm excited to get to some of those. But yeah, we'll take
Great.
so going back to the pre-submitted questions. This will be a fun one. Number 8, can vegetarian or vegan diets be optimal for brain health? Do you recommend vegetarian or vegan diets for brain health, Dr. Isaacson?
Oh, controversial question day. So I am not, I try to not have any, I try to let the evidence speak for itself. And to me, vegetarian plus, in many people, the need for a supplement of algae-based omega-3s, okay, can be a very, very, very amazing brain healthy diet. Pescatarian is a little easier for my patients because obviously, if you don't want to eat fish or people don't want to eat fish, I respect that. But omega-3 fatty acids are such a critical component. And like you could eat like, lots of chia seeds. Chia seeds just ain't going to get you to where you need to go with the omega-3s because it's like 7% of the omega-3s that are in chia seeds turn into DHA or whatever the statistic is. So to me, I'm really cautious that we individualize the diet for the person. I think a person can be a vegetarian and do well, but not if you're ApoE4 and are low on omega-3s. Vegan diets, I think, are also potentially doable. I think there's controversy here because I may say, traditionally speaking, oh, how is someone getting enough protein? What about omega-3s? I think there's a lot of, convolution there, and I can't pretend that I have all the answers, but I do think that there's data that shows that, vegetarian and vegan diets could have some could be brain healthy. It's also excludes a lot of the really bad stuff that people are eating. But to me, in terms of just totality of evidence, I don't have a bias per se. I'm just trying to go with the evidence. There's just more evidence for the Mediterranean style diet and the Mind diet, and I think animal protein really can help with protein intake in certain people that can't get in other ways. But yeah, I don't know. Max, help me out on this one.
I think pescatarian and vegetarianism would be way preferred to a vegan diet. I don't think that, I mean, to me, like vegan sort of gets, it's sort of like for whatever reason, it's the most socially acceptable, extreme fringe diet that I don't think really is merited unless you have a specific passion for avoiding animal source foods. I think vegetarianism and pescatarianism are way preferred options because at least with vegetarianism and eating fish, you get your choline, you get your preformed omega-3 fatty acids, you get your highly bioavailable animal source nutrients that would otherwise be hard to come by or would need to be supplemented for in a vegan diet. So I would say avoid veganism would be my take. Vegetarianism and pescatarianism are great. I don't think you have to eat red meat, although I do think that red meat can be healthy. Um, I don't think it's a necessity, but I do think eggs at the very least, um, you know, are beneficial.
Yep. Cool. Pretty closely aligned.
Um, Should we take some of these questions
Let's
that are being submitted over Zoom?
let's do it. Okay, we got a lot of questions. Good luck with choosing. Maybe you want to stick with nutrition. You want to mix it up a little bit. What do you think?
Uh, I think we can mix it up a little bit,
Okay.
but this is a great question that came in from Ben
No,
Churn,
no, 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 no. Anonymous, anonymous, anonymous.
anonymous. Whoops,
Sorry,
sorry
sorry.
about that.
Yeah.
Scratch
Press
that.
it. Delete.
Well,
Rewind.
okay, that's for the live. We'll clip that out for
Okay.
the YouTube.
Okay.
Um, what are your thoughts on creatine? Is it as safe as whey protein? There's a lot of discussion now about creatine. What are your thoughts
Yes.
about creatine,
I
Dr.
saw this
Isaacson?
post from Max Lugavere on my socials that was talking about this recently. So, okay, zooming out 5, 10, 15 years ago, I've always never been against creatine. I've never recommended creatine for brain health specifically, but I've absolutely been supportive of of creatine for muscle building. I think I'm not saying I think, but I'm more towards I think it could be cosmetic because the stuff goes in the muscle and it makes it look larger, or it could optimize muscle function. I don't really know. I don't pretend to be an expert there. I'm pro creatine. I take creatine myself. I put it in my coffee because that's what I do in the morning. I have used anywhere between 2 and 5 milligrams. Why am I saying this? It's because, I believe in it enough to use it myself, but I believe that the jury is still out on what are the potential protective effects of brain on brain health of creatine, I'm not sure. However, there was a recent study that looked at people with cognitive decline related to, dementia, Alzheimer's, and it was a very large dose, and we can talk about that. And it was like it was 20 grams of creatine, which is like, wow, I've never seen anything like that. And actually, the patients did better cognitively. And I don't think there were any health signals or safety signals. And I think this depends if someone has kidney disorders and someone has this or that. The take home point with creatine is I think it's very intriguing. I think it's safe. Talk to your doctor. I'm not certain. It's not something I recommend for brain health specifically, but if someone is trying to build muscle, if someone is on a brain healthy path, I absolutely do support it. And I don't recommend against it. Is 10 grams better than 5? Is 15 grams better than 10? Me personally, I haven't recommended that to people yet. I've actually seen people have gains that I believe are tangible from 5 grams alone. But I think whether or not creatine can be an actual treatment for people with dementia due to Alzheimer's or creatine versus it could be a preventative thing. I think those are two separate questions. And I think we're still very early in our ability to answer those. Max, what are your
Well
thoughts?
said. Dr. Isaacson, did you see the secondary analysis that was just published showing that that same cohort of Alzheimer's patients actually gained muscle strength and they saw an increase in certain leg muscles and a decrease in fat without exercising, all from taking creatine?
Okay, see, Max, this is why I keep you around, bud. See, this is that was the student surpasses the teacher. That's what I like to hear. I had not seen that. I saw something on something, but I didn't read the details. So,
Crazy.
okay, there you go. So I'm conservative. I have to wear the silly jacket and I'm the got to be the conservative doctor guy. But that's great. That's good to know. And that's why I'm everything in moderation, threading the needle. I am using creatine myself because I am hopeful that there are beneficial effects. And that's pretty intriguing, actually. Very cool. Now that was on 20 grams,
20
correct?
grams. 20 grams
That's
a
a
day.
yeah, that's a big dose. So I don't know what to say about that, but that's very compelling.
Yeah, I don't think you can make the recommendation yet for it, but it's definitely like a very exciting area of research
Yeah.
that needs to
And
continue.
like today, if a patient of mine who's also in our research study wanted to figure this out and they would start creatine, we would look at their biomarkers. So blood tests, we have blood tests now. We're developing our own blood tests, but what I colloquially call the cholesterol test for the brain. I believe that one day, uh, everyone in their 20s, 30s, and 40s and 50s, 60s, 70s, 80s, and beyond, before they have symptoms, are going to take, I hope we help develop this, the cholesterol test for the brain, where we look at a panel, just like LDL is like bad cholesterol and triglycerides or, whatever. We're going to have those markers before symptoms, not diagnostic for when people have symptoms, but you can go to Alz Labs, alzlabs.org, and you can learn about this. This is a mission-driven way to try to democratize access to this, and you can go to ind.org to sign up to learn more about our nonprofit research foundation. But the take home here is we use these blood tests now in a research study. And I think we have one or two people that have now recently started on creatine, and we have their biomarkers before, and then we can look and how did their brain biomarkers go before and after. So I hope, Max, on a future Q&A, I will be able to give you some answers, because in our research study, we tracked before and after effects of GLP-1s, the Ozempics, Mounjaro, Wegovy's. We have some great data on there we recently presented. Hormone replacement therapy, amazing results, really exciting. Some cholesterol lowering agents, multimodal treatments. Our data that we presented at the AAIC, Alzheimer's Association International meeting, showed that multimodal interventions work the best out of everything. So you don't just always have to take a magic pill or a drug. So that's pretty reassuring. But anyway, the answer to creatine, I think, is still up in the air. But now we have the tools, the fidelity, the biological markers to deploy so we can learn going forward.
Love it. Okay, next question. Eating olive oil, avocados, walnuts, and omega-3s all have some saturated fat. So when I eat those, my saturated fats go over 10% of my calories. So it's frustrating since I have
Mhm.
increased cholesterol.
Mhm. Okay.
So she listed off a bunch of plant-based foods, and she's still trying to hit her 10% that target. What do you suggest? Do you think it's worth paying attention to the saturated fats in plant-based foods?
Yeah.
Is that 10% a hard target? Like, how would you answer that?
I think I I split the difference. I think in one of the books I wrote ages ago, I think I chose 12% as my saturated fat whatever rate because I felt like that as a one size fits all, which we should try to get away from one size fits all because one person can have 20% of their diet as saturated fat and one person can have 5% and they'll have different results because of the interaction between genes and their environment or their nutrition pattern. So epigenetics means the interaction between your genetics and what you eat, your environment, your exposures, all that kind of stuff. So, um, I don't know, and I don't want to give, personal medical advice per se, but I don't know that 10% is worse than 12% or better than 8% or 15%. And I think it really depends on, eating a specific way and then rechecking the markers. And the markers that I would check, wouldn't just be saturated fats because we do check for those also, but I would also check just LDL cholesterol, triglycerides, something called ApoB, which is a marker that I like to track for cholesterol. So yeah, I don't know that it's possible to give a exact answer to this question, but whether it's 8, 10, 12, 14, depends on the genetics. And I wouldn't be afraid of fats. I want to really make sure that that message is heard loud and clear. Obviously, there's brain healthy fats that I know are brain healthy. I'm 100% sure, like PUFAs, polyunsaturated fats, omega 3s. Omega 6s are brain healthy, but got to balance it with omega 3s, monounsaturated fats, like you said, olive oil, avocado. But with saturated fats, I'm less sure. And because I'm less sure, we need more objective evidence. And seeing a doctor on a regular basis to get those lab tests checked would be what I would suggest.
I like that. Thanks for that, Doc.
Sure.
Okay, here's another question. Ooh, I'm curious to see how you're going to answer this one. What are your thoughts on lithium and if it can help Alzheimer's patients? There's a lot of people talking about lithium these days.
Yeah, so this has been all over the news. And what I would say is, lithium, and I may have covered this on a recent Q&A, so maybe I'll be, quicker here. Lithium's been around for a while. Lithium has been lithium orotate specifically because you can get that over the counter in low amounts. People have been taking this for over a decade. This new study that came out kind of showed that in mice that there may be like a really beneficial effect, and it may be maybe low in mice that have Alzheimer's, and lower lithium equals more Alzheimer's. I don't know. People aren't mice, and there's just so many things we find in mouse studies that just don't really translate to humans. And depending, and there's amazing science out there. And Dr. Rudy Tanzi is an amazing guy that I look up to. The guy's amazing, and his work, like his work that I've read anyway. Like I don't know that it supports maybe some of the basic science elements that were found in that study based on Dr. Tanzi's work, and the dose of lithium that would be needed to possibly have a brain protective effect in a human, like could that be toxic? So, this is another one of those things where the only way to know is by individualizing the dose to the person and then monitoring biomarkers, monitoring the blood markers. And here we go again. I'm going to sound like a broken record. We have another person that's in our research study that recently started on lithium. Their doctor said, okay, lithium orotate, and they have a baseline brain biomarker test, and they're coming back. So that's the benefit of our goal to develop the cholesterol test for the brain, which isn't really cholesterol markers, it's really brain protein markers. So I'll know within probably a couple of months whether this one person, by her specifically taking lithium supplement, in her case, her doctor said, okay, will that have a beneficial effect on brain health? So the jury is still out. Low dose, I don't think it's harmful, but I'm not sure if it's really real or not at this time.
Yeah, jury's still out. I like that. Okay, moving on. Alzheimer's runs in my family. Should I get tested for ApoE4 or just continue to do all I can to prevent Alzheimer's? I'm afraid to know.
Well, so first of all, it's okay. If you're afraid to know and you don't want to know, that's okay. But what I would say is most people that are afraid to know, I think don't fully, and I never push anyone, would never push anyone to get tested. But to me, genes are not our destiny. We can win the tug of war against our genes. And I don't know, did I come up with that, Max, or did you come up with that? Because I know you say it, I say it. Who stole that from who?
We could split the difference. We'll say maybe you contributed a component. I don't know.
Okay, great. Anyway, so I really believe that because ApoE4, one or more copies, does not mean you're going to get Alzheimer's. You can have two copies of ApoE4 and never get Alzheimer's. You can have no copies of ApoE4 and absolutely get Alzheimer's. Does ApoE4 increase your risk a little bit? Sure. But people that have one copy of E4, if they do everything right, they exercise, they eat well, they have their cholesterol, their blood pressure is perfect, their blood sugar is great, they don't drink alcohol, they don't smoke, I think 70, 80, 90% of that ApoE4 induced risk can be neutralized by making the right lifestyle choices. I really and controlling medical risk factors. When someone has two copies of E4, okay, yeah, it increases your risk a little bit, but just by changing to a Mediterranean style diet, you can reduce your risk of dementia by 35%. And then you add an exercise and sleep hygiene and stress mitigation. So I believe that knowing your genetics and knowing your genes is empowering. And the reason that we created all these free online tools, I'll put it in the chat one more time, retainyourbrain.com. When you sign up, you can type in if you know your ApoE4. And if you type in if you have one or more copies of E4, and people do this on 23andMe, people have done this from their doctors, we do this in our research study. If you go in and you type in ApoE, what you have, the software will put you down the right path for you. And that's the element here, precision medicine or personalized care. Different people with different genes need different therapies. Mrs. Smith, well, she just went through perimenopause and she has this set of genes. She may need therapies A, B, and C. But Mr. Jones, well, he's a man that's different genes, different risk factors. He's got high blood pressure, high cholesterol, big belly size gets larger, the memory center in the brain gets smaller. He needs therapies X, Y, and Z. So to me, we need to know ApoE. But if anyone out there doesn't want to know, no problem. It's not a big deal. But to me, knowledge is power.
Knowledge is power. Moving on, what brain health supplements would you recommend for someone who struggles to get enough nutrients from their diet?
Oof. So I'm not a one size fits all kind of guy. But for those out there that, um, want to know what the big buckets are, and again, I'm not making any medical recommendations. I don't think everyone out there should be taking this stuff. But, for me, for example, because I know what my blood levels are, what I do and my risk factors, I do a couple of things. I take an omega-3 fatty acid. I take one capsule a day because I do eat fatty fish, but I do take a high DHA omega-3 fatty acid supplement with some EPA in it. And that's based on my cholesterol, my genes, and my whatever, and my dietary intake. I take vitamin D. Vitamin D, I think, is relatively safe and it can be protective. And I put cocoa powder, Cocovia, nothing to disclose, no relationships on my end to Cocovia, but I've been using Cocovia for over 20 years, believe it or not, before it was cool. Literally early 2000s, I think 2001, 2002 at the CVS on 14th and Alton in Miami Beach. I'd buy these like Cocovia bars that had like blueberries in them. So a dark cocoa powder for me, I think is helpful. And it helps with antioxidants. It helps with bringing insulin down, helps with blood pressure control potentially. So for me, that's what I do based on, a B complex vitamin because I don't know, my homocysteine is a little bit high. And for people that have an elevated homocysteine level in the blood, taking B complex vitamins based on the VitaCog study, which Max and I both know, have met David Smith and Helga Refsum, who did an amazing study. So for me, that's what I take. That's the problem. Everyone may need something a little different. People that have amyloid in their brain or a little bit, plus ApoE4 variants, a specific type of brain penetrant curcumin, turmeric. And again, I'm trying not to say any brands, or I'm trying to be, balanced in that sense. But that's the goal. I think everyone needs to personalize their supplement and vitamin plan for them. I think some people like magnesium because it helps them sleep. Some people take melatonin in small doses. And is that brain protective? Does that just help sleep? I'm not sure, but is it better than other sleep medicines? I think so. Retainyourbrain.com, the free software, kind of guides people through this, and you do an assessment of what your risk is. And I think that's a way to maybe get a more personalized thing. But any big categories of supplements or vitamins that I missed, Max, that are kind of higher on your list?
No, I think those are all great. And one thing that I've for sure gotten from you is that supplementation should never be one size fits all, nor should diet. And so
Yeah.
I think you owe it to yourself to test. You can do nutrient, labs, omega-3 index, for example. But those are the big buckets. I mean, I think a multivitamin possibly can be helpful. As we discussed, I'm a fan of protein powder. I personally take creatine, although I'll say that the brain health stuff, as Dr. Isaacson alluded to, the jury is still out. Magnesium, I personally think is great for for sleep. I take it also, it helps prevent migraines and whatnot. But yeah, there is no one size fits all. So I think it should be a personalized approach.
Great. Yeah, we're entirely aligned. Great.
All right, I love it. This is another question that I think is really important to touch on, even though it's not necessarily about prevention. If somebody already has Alzheimer's mild stage, what are the best interventions by impact? Diet first or fitness first?
Oh, well, it's all about the biological principle of synergy. So 1 + 1 = 3. There was a guy named Carl Kottman, Dr. Kottman, did amazing studies, probably a decade ago, maybe less, where he and I'm paraphrasing because it's been a while since I read the study, but they had dogs and they gave the dogs a very specific diet that was like, brain healthy. And then they had the dogs that just ate the brain healthy diet versus the dogs that could exercise more and together, and then they could socialize. So the biological principle of synergy suggests 1 + 1 = 3. When you add in diet alone, okay, well, that gives one effect. When you add an exercise alone, that gives one effect. But when you add an exercise and diet together, and plus socialization and plus all these other things, it just kind of ramps everything up to have a much stronger beneficial effect. So to me, I don't like choosing one over the other, but I think the body of evidence actually does suggest that exercise on a regular basis, exercise lowers amyloid levels in the brain. Amyloid is the pathologic protein that builds up in the brain of a person with Alzheimer's. I think the evidence is stronger for exercise, but you can be exercising all you want if you're not having enough, carbs and protein around the time you're trying to build muscle. You're not going to build muscle. You can exercise all you want, but if you're eating like, ice cream before bed and like it has trans fats in it and it has lots of fat and like you're not getting the right nutrients, you're not going to lose fat. You have to do the right exercise, steady state cardio to zone 2, lower intensity to try to lose body fat, strength training because you need to build muscle, maintain muscle, to have adequate metabolism. You build in together an exercise plan that focuses on the individual things that person is trying to work on. And then you have the nutrition to give the fuel to make things work better. And then you do everything else. That's how you reduce risk of Alzheimer's. That's how you prevent, in an ideal world, Alzheimer's. 45% of cases of dementia may be preventable if that person does everything right. And that's what we're shooting for here.
Yeah, I would have to agree. I mean, exercise is medicine, um, for the body, for the brain. So thank you for answering that. I guess we have time for one more. This is a question about hormone replacement therapy. Is hormone replacement therapy dementia protective for women over 55?
Oh, over 55. Okay, so let me take a step back. So, hormone replacement therapy to me means the use of estrogen and or another hormone like progesterone for women as they go through either the perimenopause transition or when they're postmenopausal. So, I'll take another step back. I have learned more about this topic, which I can give a shout out to Maria Shriver, who was responsible for me buying the shirt at Macy's in Pasadena back in 2015, but also was responsible for saying, Isaacson, why do more women than men have Alzheimer's? Why are 2 out of every 3 brains affected by Alzheimer's women's brains? Why is it, Isaacson? And she jabbed me, and I said, I don't know. They live longer. She said, Isaacson, figure it out. And that's what we did. And we spent, $10 million on a brain imaging research project and all the stuff we're doing now at ind.org. So I have a lot more education on this. So when a woman goes through the perimenopause transition, their estrogen drops. And in certain women that have one or more copies of the ApoE4 variant, that woman is at extra high risk of fast forwarding of amyloid deposition. So the perimenopause transition affects certain women more than others in terms of brain health. So it's a lot more standard, a lot more, I would say, commonplace that when a woman has perimenopause symptoms, night sweats, maybe some brain fog, variety of other things, that if a woman is symptomatic and their estrogen drops, then we can use hormone replacement therapy in combination with the treating GYN, primary care doctor. I'm a preventive neurologist. And what we do personally, I saw this question in the chat too. We look at estradiol levels and we try to, use hormone replacement therapy to one, make the symptoms better because we want women to live a higher quality of life. It's not just like, oh, I'm sweating at night, change the temperature in your room or get a cooling pad on the, maybe that'll help too. But no, this is a neurological problem. Perimenopause is a neurological problem. It's a real condition that needs to be treated. And there are too many doctors that just still don't get this. And I hate to say it, I was one of them 25 years ago because that's what I was taught. Oh, night sweats, change the temperature. No, treat the hormones if someone has perimenopausal symptoms. So in someone who is perimenopausal in their late 40s and early 50s, I think it's pretty common or much more common for women to be prescribed hormone replacement therapy. We recommend generally, I'm not your doctor, please talk to your doctor, bioidentical hormones. We tend to use patches better than pills because it's slow transdermal bioidentical estrogen can get absorbed. We then track the estradiol in the blood every few months, and then we track for symptoms and we try to level it out. All the units are different. We use the Boston Heart Labs, whether it's 50 is the low target or 40 or 60 of estradiol. I don't know, everyone's a little bit different, but that's something we look at. We look at the symptoms, the clinical and the biological, and how the person feels. Are they sleeping better? Do they feel better? I believe that using hormone replacement therapy, this is my personal opinion and based on, evidence, that is coming around, that longer term use of hormone replacement therapy is protective on women's brains. I was taught that, after 5 to 7 years or 7 to 10 years, women have to stop hormones because of, this risk and that risk and that risk. And I'm not really sure that that is correct because, the studies that were done in the past weren't bioidentical. There was let's get the hormones from horse urine and let's test it in the 90s and then let's publish a paper in the 2000s and then 20 years later we're still thinking the same thing from a study that was done decades ago. So when you use these bioidentical hormones, and in our research study we showed that, my team at Cornell, that I was a part of and recruited patients for, the women that had estrogen replacement and hormone replacement therapy on board, their brains looked better. Their brains didn't age as much. They didn't have as much atrophy. They had less amyloid protein. And we had women into their 60s, into early 60s that were still on hormone replacement. So the take home question, and the question was, what about hormone replacement therapy for women 55 and above? Talk to your doctor, but I'm generally okay with it. I think the other thing is, we just presented these data at the Alzheimer's Association meeting, and our youngest woman was 42 years old, and our oldest woman was 67 years old. And two of these women that we've tracked before and after starting hormone replacement therapy, two women, one was 60 and one was 67, and we're just starting another woman. So we now have about three women that have been started on hormone replacement therapy in their late 50s or later. And that's new. That's the thing. And if all the doctors were aligned. So the take home point is we don't have sufficient evidence to be definitive about this, but in our recent study that we presented, not fully published yet, but we presented this at the Alzheimer's Association International Conference 2025, it showed that we had improvements in brain marker proteins like the tau protein after a woman starts on hormone replacement therapy. And that's, I think, the answer here. So if you're a 55-year-old woman looking for answers, talk to your doctor. But one day we're going to have this cholesterol test for the brain. It'll be out there. If you want to learn more, you can sign up at ALZ Labs, alzlabs.org. You can learn more there. IND.org is doing a lot of great blood biomarker work, and retainyourbrain.com also in the chat to learn more about this. There's tons of content about HRT. But yeah, I believe that HRT is amazing and needs to be used responsibly and at the right time, at the right dose, and the right woman, and have the right doctors paying attention.
Love it, Dr. Isaacson. Well, thank you so much for your time. How can viewers learn more about Retain Your Brain?
Well, so retainyourbrain.com is all free, NIH funded study. We did a large 988 person randomized controlled clinical trial. This is a study that all the bells and whistles on clinicaltrials.gov. The paper has been submitted. We presented these data earlier. Retainyourbrain.com is free. It's like a virtual neurologist in your pocket. Try to manage risk factors for Alzheimer's disease and optimize and maintain, improve, whatever we want to call it, brain health. We really have put everything out there. We put my brain in software, scary. Before AI was cool, we were doing it on retainyourbrain.com. And if you're interested in learning more, definitely take a visit. And then finally, to end, please remember, I'm going to put the link back in the chat. If you haven't filled out the survey about this Q&A, please take a minute to fill out this quick survey. It's only about 5 minutes. We'd love to make these sessions, more applicable to you. Max Lugavere, thank you so much. You're an amazing host, moderator, science journalist, partner in crime, colleague, and friend. Thank you so much, Max. Really appreciate it.
Thank you, Dr. Isaacson. And thank you to everybody who's tuned in, especially those who've come over from, my side of the world. Thank you guys so much. And we will talk to you again. We'll do this again very soon.
Okay, love it. Thanks so much.